Before we move on to the agenda, I just want to provide a brief COVID-19 update. Yesterday, we declared a 30-day state of emergency in order to take some urgent short-term actions to combat the current Omicron surge. We enacted 2 executive orders to assist hospitals, nursing homes, and our EMS workforce in addressing staffing shortages. And we mobilized 1,000 members of the Maryland National Guard to support existing COVID-19 testing sites and to open 20 new testing sites outside of hospitals all across the state. Yesterday, I also had a COVID briefing with the White House and all of America's governors. And one of the issues that we discussed was the serious national shortage of at-home rapid test kits. It appears that it will still be many weeks before the federal government is able to begin distributing more tests. Here in Maryland, we continue to acquire tests, and currently we have an abundant supply of PCR tests. In addition, last month, we began distributing 1 million at-home rapid tests through local health departments. And I just want to inform the board that in order to address this national shortage, we're currently working on numerous emergency procurements to deal with the multiple emergency actions related to the crisis, including the acquisition of as many of these rapid tests as we can possibly acquire from multiple different sources. As I said yesterday, the next 4 to 6 weeks will be the most challenging of the entire pandemic. And just to illustrate the gravity of the COVID-19 surge that we're now experiencing, I'd like to just briefly share some new data that we received just yesterday since my emergency declaration. Over the last month, we've been expanding our sequencing of COVID-19 variants, particularly those with an S gene dropout, which is a distinguishable marker for the Omicron variant. According to University of Maryland's Institute for Genome Sciences, 88% of all recently analyzed samples tested positive for the Omicron variant. And of those samples that were hospitalized patients, 91% have the Omicron variant. Among our state's lab-confirmed COVID-19 cases, I said that we also have some additional data, brand new data from the University of Maryland Medical System, which shows that over the past 30 days, 74% of their hospitalized COVID-19 patients are unvaccinated individuals, and 24% of patients are vaccinated, which is consistent with what we've seen in the past. But the most important data point that we found is that only 2% of all of the COVID patients in all of their hospitals over the past 30 days were people who had received booster shots. So while we're going to continue to take whatever emergency actions are necessary to withstand the current surge of Omicron, I just can't stress enough how important it is to get your booster shot as quickly as possible. With that, I'm going to turn it over to our colleagues for any opening remarks, and I'm going to start with you, Mr. Treasurer. Again, welcome, and the floor is yours.